Hello and welcome to Health Bytes. Health Bytes is brought to you by the Public Health Unit of the Ministry of Health and Social Development. I'm your host, Public Health Communications Specialist, Natasha Ledsum Humphrey. Now, last week on the program, we talked about the Bridge the Gap Showcase, and we're here, as promised, to talk about destigmatizing mental health services in the BVI. We have with us Miss Neverly George Bronstorff, and she's the Acting Director of Safe Haven Transitional Center. Welcome, Neverly.
Thank you. It's good to be here, Natasha.
Wonderful. Thanks for coming. And we also have Dr. Albert Tompkins, and he is a counselor with the EAP. Welcome to the program, Dr. Tompkins.
Thank you for having me.
Wonderful. Now, we know a little bit about the Bridge the Gap, the showcase. Tell us a little bit about you as a counselor and services at the EAP.
Sure. EAP stands for the Employee Assistance Program. We're actually under the Human Resource Department in the government of the Virgin Islands, and we provide free, brief, confidential professional counseling to every public officer and their immediate family. And so we strive to assist public officers not only in their work life, because you may have issues at work, but also in your home life, because reality is you don't leave your problems at home.
Definitely.
And so the government has invested in the public service to have a counselor on staff to assist them if they're having issues at home.
Wonderful. It's a beautiful service, and we're going to dive into that and kind of some response or feedback that you've had from, the public service as we're talking about destigmatizing mental health services. Now, Neverly, I know that we have the Bridge the Gap showcase coming up. Remind us of the date, remind us of the location, and what's actually going to be happening.
Fantastic. So we have coming up on the 21st of May. That's next month, right around the corner, our Bridge the Gap, the showcase event. The event is somewhat of a two-part. We have pre-events that is going to consist of first thing in the morning, 6 in the morning. Let me make sure I have the time right. At 6:30 in the morning, we're going to have yoga on the lawn, and this is going to be with Miss Tisa Donovan. And this is being sponsored by one of our main event sponsors, the Tortola Pear Park. And directly after that, we are going to have Soca Aerobics with Mitch Gordon. So it's going to be quite an exciting day. That's just really the warm-up for wellness, the pre-event for our entire day of wellness. We're going to have some light refreshments served afterwards. So we're asking persons, yes, to come to this event and go home and get ready to come back at 10 for the main event. The purpose of the event really was because we saw in the territory that there is a need for a community to know who the providers are of wellness providers, mental health providers, persons who provide life, whether it's a life coach, a psychologist, psychiatrist, and we're going to have some spiritual leaders also, because we know that persons may not want to see a provider, a wellness provider, a counselor. They may want to speak to our pastor. So we're going to have someone talking about how mental health is linked with spirituality. So the day is going to be quite exciting. A full day of activities for the entire family. We're inviting the entire public to come out and participate. We're going to have CCT is going to be there. They're one of our main event sponsors. We're going to have a bouncy castle for the kids, live DJ performances in song and dance. We're going to have free massages, a session that focuses on teaching individuals mindfulness and meditation as a form of coping. And more. I don't want to give away everything.
Oh my gosh. I mean, you had me at the, the soca aerobics and the yoga, the pre-event warm-up stuff just to get your mind right. And I like that mindfulness too. That mindfulness, I learned a few techniques in it, but I would definitely like to learn more about that.
It's amazing. Yeah. It's amazing. Yoga, mindfulness, meditation. These are all things that help us to remain in a state of balance and to cope with the day-to-day stressors. We also have a raffle, amazing prizes from CCT, which one of our main event sponsors. Cell phone, iPhone limit. I think it values about $900 to $1,000. We have a laptop from Infinite Solutions. Other amazing prizes we have from iSmart. We should be getting a tablet. Wonderful gifts from Clarence CTL, Clarence Thomas Limited. Who else do we have? Get from Save the Seed, Speedies, a round trip ticket to Virgin Gorda, and a lot more good stuff in store.
Wow.
And we have some giveaways also that's going to be focused on really mental health, mental wellness from some of our providers who are going to be there. They're going to be giving gift certificates to persons who come who might be new to accessing mental health services. They're going to have some free giveaways so they can come and get a free session or a free family session. Or Wellness Center is going to be sponsoring a BMI index, free BMI index assessment. Lots of great stuff, Natasha, we have in store for the entire public. We're just asking everybody to come out.
Wonderful. And we know that our topic here, we're trying to destigmatize, because as lovely as that song, that family event just focus on, well-being, mentally, physically, socially, spiritually, everything, we still have some reservations. So I want to know, from your vantage, and we're going to start with you, Dr. Tompkins, how is accessing mental health services perceived here in the Virgin Islands?
Yeah, I think off the bat, there's a big stigma regarding mental health, mental illness. And so specific for the public service, a lot of times persons do not want to come because of the quote unquote stigma. What does it mean? If I'm seen with Dr. Tompkins, am I crazy? So people, say certain things negatively regarding it. And so from my vantage point, unfortunately, and it's not unique to the BVI, in this entire industry, I would say, or this entire field, there is stigma regarding mental health and mental illness, and specific for those who are of African descent. We have, for some reason, kind of behind the curve in understanding and embracing mental health.
We see it a lot, Natasha, because for whatever reason, persons who seek to access mental health services are person who may have been diagnosed with a psychiatric disorder, mental disorder, mental illness. For whatever reason, they're viewed as probably being weak, or I know long ago it was seen as a person probably has some kind of possession, demon possession. They're not able to manage. So because of this, you will find that individuals who, and sometimes it may not be even a diagnosis of a mental disorder, it may just be that you're anxious, you're feeling overwhelmed at work, you're having problems in your relationship. It could be any number of things. You're having a hard time coping with COVID, inflation, everything that's going on, and you want to seek help. You realize that you're not managing well, but for whatever reason, you're apprehensive about going and seeking these services because of the view that that you're looked upon by society as something is wrong with you. You're not able to cope well. That you're different, you're abnormal because you're seeking mental health services. So we see that a lot. And one of the reasons why, again, we decided to have the Bridge the Gap event is so persons can be in an environment where it's there's no stigma, there's no judgment, it's nice and relaxed. We're easing persons into it. So all of the providers are there. The main providers in the community who provide these type of services are going to be there, including the Employee Assistance Program of the government of the Virgin Islands and community mental health. Everyone is going to be there. So we're creating this now environment for persons to come who may not be coping well, or who may be interested in seeking these services, or who may know someone who needs these services. We're creating this environment for them to come now and just learn, to know who accesses these services, how they can get them. So it's an environment where we were hoping persons will now come and learn, and we're able to reduce some of that stigma that's attached to seeking mental health services and eventually eradicate it completely.
Well, definitely, I think you're going about it the right way, because you do need a community approach to destigmatizing mental health services, because believe it or not, peer pressure is real. And like you said, people think that someone will have a negative, thought about them accessing care. and they're not thinking about themselves needing the care. We living in COVID. We living with all the impacts of COVID. You know, how many people around here have lost their jobs, have lost family members, have had to change their way of life. We went through so much over from the hurricanes of 2017. You know, that has impacted our mental health in many ways, and a lot of people are not coping well, like you said, but they're scared to access help. And I'm so glad to see that, you know, this intervention is being made to kind of draw people in. It's okay. It's okay. I love EAP. I've accessed the services many times. And like, I know it had a point in my life where I had an EAP counselor, I had a therapist, and I had a trusted friend talking to that help you maintain that equilibrium, because in my opinion, my mental health is more important than my physical health, because if I'm not good in my head, how can my body be good? But what are your thoughts on people placing more emphasis on their physical health over their mental health?
And I always say this. I always ask people, so how many organs do we have? And they'll say a number. And I say, well, what are your organs? And they'll start saying certain things. And I say, also, you have a brain as well. It impacts your mind. And so from my perspective, I truly believe that your mental health is actually more important than your physical health. You can hurt your foot, you know, and you'll be okay. But sometimes there are certain conditions of your mind, of your brain that actually impact physically as well. So to me, it's more so focusing on both at the same time. You know, if you have a problem with your heart, you go to a cardiologist. So, but where do you go when you can't process properly, or you're down and you can't seem to get out? You know, I think at those points we should go to persons that have been trained to help you in those areas, because there is a specific science to it. There is research to back up different approaches to help persons, and so we're not just willy-nilly out there just what they say, tree huggers per se, right? But we are actually following a protocol. We're following certain guidelines so that we can actually impact persons for better. So I believe personally that your mental health is just as or even more important than your physical health.
You're not saying that,
Most definitely. Whole person care. Yeah. Whole person care. It's important that we're catering to the entire person holistically. So we look at mental health illnesses or psychiatric disorders as chronic medical conditions. They are medical conditions. Yeah. So then why would we feel comfortable going to treat our hypertension or diabetes or heart problem? We feel that it's okay, and there's no stigma attached to that. But when we go to take care of our mind or mental health, what's going on with our mind, then there's a stigma attached to that. It's the same thing that doctor said. It's part of who we are, our makeup. You know, so we find persons are still experiencing PSTD, post-traumatic stress disorder from 2017, from the hurricanes of 2017. Right now, a lot of persons are experiencing anxiety and what's going on in the economy, war, COVID. A lot of persons are experiencing grief and loss. So if we're not doing well mentally, then we're not able to cope well. We're not able to focus. You know, sometimes you're not able to get out of bed if you're depressed or dealing with some other type of mental illness. So therefore, I would say that it is equal as important as your physical health, because if you're not doing well mentally, you cannot do well physically. Definitely. You may be able for a while, but eventually, if it's not treated, just like if you have untreated diabetes, it becomes a chronic problem and you're not able to function. If you're not treating the mental illness, whatever it is, or anxiety or depression, then you now become incapacitated. You are unable to function. And even not so much on that magnitude, on that scale, but even, you know, in your everyday life, like you said, taking care of you. Because what I found is, you know, once your cup go dry,
how can you give to somebody else? So all of that is a part of, staying balanced mentally. And, because I even had a situation where I went totally dry and you don't have anything to give. Exactly. So at that point, when you reach rock bottom now, you have to take time to build up. So now you seeing yourself and you might feel a little bad because now you have to be selfish to get back to a place where you can function and give to others. But if that's what you need to do, that's what you have to do, because you can if you don't have anything to give, you can't give anything. So what would you say that the community can do to help to destigmatize, accessing mental health services, destigmatize, not feeling guilty because you want to be selfish and do things that, will help you to build your mental health and, just basically be a little bit more balanced within our thoughts and our everyday life to help us to seek services when we need it.
I really appreciate what you said, Natasha, because one of the things that we can do as a community is being open. Talking about, normalize a conversation of having a therapist, having a spiritual leader, a pastor, a trusted friend. Be open and comfortable with talking about your issues with your mental health. And having that discussion, I appreciate the fact that you said it. And even me as a clinical mental health counselor, there was a point when I access the employee assistance program services. I think it's awesome. I have access to that. I have a friend. Sometimes I'm really down and I just say, I need a hug. I need to have friendly voice. All those little things that you can do. The community, what we really need to do is try and understand about mental illness, what they really are. It's not a death sentence, because a lot of persons think that you're diagnosed with a mental illness, your life is over. It's a matter of educating ourselves about the different types of mental illnesses or mental issues that persons can have. That's the first thing. And of course, come out to this event where you're going to learn a lot about mental illnesses and the providers. Again, that's part of it, educating yourself. Also, being more compassionate to persons who are struggling, with a diagnosis of whatever it is. Be more compassionate, be more empathetic, and just try, I think pretty much, educating yourself about what mental illnesses are and knowing that it is treatable and persons can live normal lives. You can be in an office and there are 3 persons there who's been diagnosed with a mental illness and you don't know because they're functioning normally. Okay. I don't know if Doc had anything to add.
The only thing I would add is that I always give the analogy of when you're taking a flight. They say if the air pressure changes, the thing comes down, you put your mask on yourself first. So you have to be, like you said, selfish first. And once you do that, then you can help someone else. So I would say, have some grace with yourself. Take some time and understand what you're going through, because you didn't get over like this overnight. It's a process. And it may not happen, one day, 1 week, 1 month, but go through the entire process and allow yourself to, get some help, get some assistance. And like she said, talk about it, be open about it. And I think that's one of the greatest things to combat the stigma, is actually have an open discussion. So I'm so thankful for this Bridge the Gap showcase, because it provides a community discussion.
Yes.
And we're not in our own little silos and we feel ashamed. And we actually all have mental health. The question is, how are we dealing with it? That's the issue. Because if you have a brain, you're going to have a mental health. So I think, because again, like she said, we're human beings. We're spirit, soul, and body. So we cannot negate one of the most important organs is the brain. So I think all that put together helps understand that we're all human and we all have ups and downs. And you may not even have a diagnosis per se, because there's a very specific criteria to get a specific diagnosis. Definitely. You may be going through a period of time, like you said, a period of time. And you may not need a psychiatrist per se, but maybe you need a counselor, maybe you need a life coach, someone to assist you through your daily walk. So that's my take on.
Definitely. And Neverly shared with us the time she accessed our mental health services. You as a counselor, have you ever accessed our mental health services?
Part of our training actually is to actually go through therapy and get some counseling. That's part of our training. We have to. So I tell persons all the time, every counselor needs a counselor. Every therapist needs a therapist. That's part of it. In fact, about 2 years ago, I lost my mother. And I was still counseling persons at the same time. And it got to a point that someone had to tell me, listen, you need counseling. I'm like, I do? Because I couldn't see it because I was still busy helping.
Yeah.
But then I had to pause and get someone to assist me. And so, yes, I have. And that's because, again, I have to, take my own medicine, right?
Definitely.
Because every doctor needs a doctor.
Definitely.
Who do they go to? They can't help themselves, right?
I agree. And, sorry to hear about your mom.
It's okay.
And, basically everybody needs help from time to time. We don't like to admit it sometimes, but we do. And I think that the problem lies therein when we are afraid to admit it. Yeah. And then we allow the spiral to go out of control, because then right now we're in Child Abuse Prevention Month. A lot of that issues spill over to our children, and we end up abusing them because we're not managing the stressors, because we are not seeking intervention for the stressors. So tell us when, Dr. Hopkins, we should really look to access care. At which point, what are the red flags?
Great question. I would say is, let's say you're struggling with something, what's called your ADLs, your activities of daily living. Let's say, you can't seem to get up. You can't seem to take care of yourself properly. You're noticing that you're down, but you feel as if no one can help you. Those are some signs that maybe I need to get someone else to assist and find out what's going on with me. And maybe you're not enjoying life like you used to. Maybe there's an issue that you just can't seem to get over. And maybe you haven't times past, but all of a sudden now something's different. You feel like you're in a dark place. As a cloud, those kind of small things, just to see how things are going. I would say don't wait till it gets too bad where, we have to do intervention, but just do some preemptive kind of assessment to see, maybe I need assistance. So that's what I would say. Because a lot of times it's the little small things. Maybe you're more annoyed than you usually are, Maybe you're more frustrated. You're lashing out. I can remember when the hurricanes came. I noticed I was lashing out at my kids for no reason at all. I just said, whoa, calm down, Tompkins. It's going to be okay. And so I had to talk. Sometimes my coworkers and I in the EAP, we talk to each other. We counsel each other. So I think those little small things are indicators that maybe I need some assistance. And then maybe you don't. But why not try now, right?
Why not? Anything you want to add there?
No, most definitely. It's because I'm just listening to, and sharing and what we're saying. And we just really want to put it out there. It is okay to access mental health services. Right. And listening to myself and Dr. T saying that we have access to these services. Nothing is wrong with us. We're trained. We're counselors. But everyone needs to seek that assistance at some point. Once you're human, you're going to need that. And there's absolutely nothing wrong with that. You cannot, you mentioned earlier that you were giving. And what happens, particularly for individuals, whether you're in a helping profession or otherwise, you realize that you're giving and you're giving and you're giving, you're helping and you're serving, and you too are dealing with the stressors of life. You too have challenges that's going on in your job or otherwise. But if you are not pouring into yourself, then you're being depleted. So it's important now for whomever, because sometimes too I have strong friends. We all have that strong friends and we probably consider ourselves to be strong, but strong individuals need that assistance. So it's okay to ask your strong, how are you doing? Find out what's going on with that person, have that conversation with them. Because we all need that assistance. We all need that help. It's completely normal and it's completely fine.
Definitely. And like I said, I learned that the hard way. We women of this generation, we want to be super women. We don't need men, we don't need this, and we don't need that. We're independent, and we this, and we that, and we got the children, and we this, and we that. But at the same time, not all the time you want to be superwoman. You want to be a baby sometimes. You want to be taken care of. And like for me, when I hit that stage, like, okay, I'm superwoman, but I don't want to be superwoman anymore. I took a break. I took a break for so long, I had to talk to myself as a man, you're overdoing it. because I really hit rock
Yes.
bottom, and then once I got to the place where I felt like, okay, I'm overdoing it now, I was like, okay, I'm back to some sort of
Yes.
equilibrium.
But it's like Doc says, your body gives you signals of when something is off. For example, I can go back to 2017. Sometimes you're not sleeping. You're dealing with insomnia. You never had that challenge before. You're easily agitated. You're low energy. You recognize, and it's very important to be self-aware. You recognize that something is wrong, something is off, and it's important that you do go and seek help just to get to a better place. It doesn't have to, it may not be any major mental illness or whatever, but it's important that and like you said, you are the person who would know that when you've had that break and you're in a better place and you're feeling like yourself. It's very important to be self-aware, to know when something is off and you're needing self-care.
And it makes you better. That whole process has enhanced my life in ways I didn't see coming. Like, because I went through that. And I took that time and I evaluated and I did, like I said, I had a counselor, I had a therapist, Sometimes, and the things of life, they don't hit you all at once. Sometimes it's phases. So it's like, okay, when it's not my turn to see the EAP counselor, I have my therapist in my office. I'm like, can you talk? And you have to get it out, because in from where I sat, if you don't, and you bottle up all of that negative emotion, that is when it spirals left field and it spirals out of control. Dr. Tompkins, what kind of feedback have you had from persons accessing EAP services?
I think once they access the service, they love it, because it was, wow, I can get help. I'm not in this by myself. And I think at that point, then they become good advocates for it. They'll tell their friends. I think I have clients that tell other persons, go see AP. They help me out. So I think once they actually get past the stigma, past the fear, and come and sit down and have a conversation, I believe they're helped. That's my opinion, but maybe I'm biased. But I've heard good things, though. I heard good things going forward. Because, again, it is a service to every public officer for free to them.
Right.
So
and invaluable services. I could be a poster child because, like I said, I've accessed the care on 2 different occasions over a span of years, and I've never had any issues with hearing my business on the street. I never had any issues with confidentiality breaches. So all in all, I would be one of those advocates, and I really feel strongly about optimum mental health. I really feel strongly about, filtering your thoughts, managing your thoughts, managing the way you think about things, the things that you let into your system, what words you let resonate with you. Because all of that, to me, from what I learned, plays an important role in establishing novel mental health.
Most definitely.
Definitely. So back to Bridge the Gap. This was an awesome conversation. Just basically trying to soften up the community and letting you guys know that it is okay to think about your mental wellness. It is okay to be balanced mentally. I mean, yes, we're all about physical, and we want to eat our fruits and vegetables and exercise for 30 minutes a day. And we want you to do that too. But we need to take care of this. We need to take care of this. And we have this wonderful team. We have the Bridge the Gap Showcase coming up on May 21st that we want, community involvement. Because if we're trying to destigmatize mental health in this society, we definitely need the community to get involved. So before I let you go, final thoughts?
Final thoughts. I am super excited. We are super excited. The Safe Haven Transitional Center and the Ministry of Health and Social Development are very excited to be bringing this wonderful initiative to our community. We are sincerely grateful to our main event sponsors, BVI Red Cross, CCT, Pear Park, Nagico Insurances, BVI Tourist Board, P3s, and all of the others, Nova Vita, all of the others. to the individuals who are going to be having their wellness booths, just to name a few: Therapy to Thrive, the Wellness Center, 5 Doctors, Employee Assistance Program, of course, Community Mental Health, BVI Public Health, and the others that are going to be there, Trinity Counseling and Therapeutic Services, or spiritual leaders who are going to be there. We thank you for just agreeing to be a part of this great initiative. To our individuals who have provided a raffle, we thank you, and we look forward to the community coming out in numbers. Even if you are not interested in anything about mental health, once you get there, you will be. And there are going to be so many other things to just keep you active and involved for a day of wellness. May is Mental Health Awareness Month, so we just want persons to come out and take care of your whole person. Okay, it's going to be an awesome, awesome activity event, and thank you so much, Natasha, for having us, giving us this opportunity.
Definitely. Dr. Tomke?
Well, I'm excited about this event, and EAP will be there. And if you happen to be a member of the public service and you desire some assistance, please contact us at 468-9889. Again, it's free to you, it's confidential, it's professional, and we want to assist you. You are not alone. Because remember, where your mind goes, where your mind leads, your body follows. So take care of the whole body, and we'll be happy to assist you.
Definitely. Well, I would like to thank you guys for coming on the program today to talk about this Bridge the Gap, the showcase coming up on May 21st. Remember, the pre-event starting at 6:30. Get all your movement in, your meditation, your so-called warm-up, and then come back at 10. We have panel discussions, we have raffles, we have life coaches, spiritual leaders, men. We have something for your entire being. We want us as a community to move forward. Healthy mind, body, soul, spirit, and we want to get there as a community. We definitely need community involvement to destigmatize mental health services, mental health issues, just having a positive mental health in the BVI. So we definitely need you to come out on the 21st. Bring the kids, because we need to teach the next generation that it is okay. We definitely need to support that, especially, like I said, we're here in Child Abuse Awareness Month, and that's all apart. We have a lot of children here, as we heard from when the team was on a few weeks back, talking about how many of our children here are being molested and having issues. So maybe they might need some thought of counseling. Don't ever forget the children, because the children grow up to be tomorrow's adults with problems if we don't fix them from now. Okay, so remember, we want to see you out there May 21st, Bridge the Gap Showcase, Tortola Pear Park. Early action starts off at 6:30, but the main event is at 10 a.m. Okay, so remember, share this video, share this information, and come out and support this community event, because together we're trying to go towards a healthy Virgin Islands, and we get in there one step at a time. So reporting for the Ministry of Health and Social Development, I am Public Health Communication Specialist Natasha Latham Humphrey. Thank you for tuning in.